Dr. Shraddha is going to present to us the conjunctival hyperpigmented lesion.
Good afternoon, everyone. I'm Dr. Shraddha Samani, going to present a surgical management of conjunctival hyperpigmented lesion with amniotic membrane transplantation. Introduction. Pigmented conjunctival lesion exhibit a wide variety of appearance, and the differential diagnosis of this include the nevi, melanosis, and malignant melanomas. The amniotic membrane transplantation can be used to reconstruct the conjunctival defects created by the surgical removal of such pigmented tumors. A case report. A 5-year-old male child brought to our hospital with a blackish discoloration of right eye since birth, which was painless, gradually increases in size with age. On detailed examination, the large pigmented lesion of 5 cross 9 cross 1 mm over the bulbar conjunctiva temporally with the raised anterior segment, ocular position, movement, and the posterior segment is normal. This is the pre-op photograph of the patient. We can show the temporary there is a hyperpigmented lesion. A written and the informed consent was obtained from the parents prior to surgery, also for the use of the amniotic membrane. The excision of the lesion and the amniotic membrane graft was used for the reconstruction of such a ocular surface under the general anesthesia. The resected tissue was sent for histopathological examination, which revealed the small nest and the clusters of the benign melanocytic cells containing extensive melanin. There is no evidence of malignancy is noted, and which is diagnosis conjunctival nevus. This is an intraoperative photo. The first photo will show that there is we resect the lesion, and the second photo is for amniotic membrane transplantation. And this is the post-op 6-month photograph. This shows the healing of patient. Discussion. Regular self-examination in which a patient recognizes suspected lesion have been shown to be important for the prevention of and early detection of melanomas. To help the patient identify the suspected lesion, ABCDE rule often recommended, which include the several clinical melanoma features. In our case, the large bulbar conjunctival pigmented lesion with color variation in size progression was known. Removal of such a lesion can be therapeutic challenge. The effectiveness of the transplantation sufficiently indicated as a supplements of collagen layer and basement membrane. The MT have been found to be a good choice for the reconstruction and the restoration of the persistent epithelial defect of the cornea as well as conjunctival defects. In our case, we decided to reconstruct the vast conjunctival defect using the amniotic membrane, and this eye's course of healing was quick without scarring and complication. The conclusion is a surgical excision combined with amniotic membrane transplantation reconstruction is effective and economical for the treatment of large conjunctival lesions. AMT should be considered as a secure and easy option in the reconstructive ophthalmology.
Very good, actually. Very good. Any questions from anybody?
So the amniotic membrane is placed even before histopathological diagnosis, or
no, sir. It is in the one time we do procedure, surgical excision with amniotic membrane transplant. Because this is a big lesion, so we decided to transplant the amniotic membrane.